Another issue that may have caused joint pain is the electromagnetic field. Electromagnetic field comes from cell tower, cell phone, iPad, computer, too much TV. These electromagnetic field not only does it affect us, but also affects the whole entire Earth. Because our Earth is filled with, the cell phone tower. Everybody using cell phone nowadays, right? It's affecting the bird in the sky. It's affecting the bee population. It's affecting the insect population. If you look into more research, the bee population has gone down about 60%. And just imagine that another 50, 100 years, the bee will be extinct because of the technology we have. Our body produces a natural forces, energy, and this energy is also because this energy has interconnection with the earth energy as well too. Okay. Now, when these natural energy are affected, are interrupted by either X-rays, radiations, sun radiation, infrared, ultraviolet ray, cell phone tower, computer plugs, all these can affect our natural energies. Okay. When these natural energy are affected, our bodies start to go haywire. The function of our body start to go down. Okay. So that's the reason why it's very important that we look into this matter. There are ways to test it to know if your energy has low. If your energy is low, we gotta make sure we add it in. We replenish the good energy that you're missing. Okay. Your nervous system. How does that relate to the pain, the joint pain you have? Of course it is, because your nervous system, from the brain all the way to the spinal cord, each different spinal cord are responsible for each different type of organs. For example, the lungs affected by T1, T2, your liver is affected by T9, T10, your bladder is affected by L2, L3, okay, your heart is affected by T3, T4, and your neck and your arm is affected by C5, C6. Okay, so let's say if your organs are affected, right? The function of the organ, let's say for liver and kidney. Liver and kidney is to detox. If your body cannot get rid of toxicity, the toxin remains in the body and goes to the finger and the toe, causes severe pain, right? If the stomach cannot function well because of the spine issue, nerve issue, body cannot digest the food, the toxin goes to the finger. If you cannot regulate your circulation, the heart issue, the blood circulation cannot drain the toxin out of your body. Therefore, the pain, all the junk goes to the finger and the toe. Because the body is like a body of network. A network. Everything interconnects. Everything works with one another. If it's one little thing missing, or one little thing that's not working, it's going to affect the entire body system. So we're looking, when we treat the arthritis, when we treat the joint, any kind of pain, joint pain, we have to look at the whole system. We cannot just treat the fingers. We cannot just treat the toes. We cannot just treat the shoulder. We cannot. It will not work, because if you only treat that, if you only do a localized physical therapy, localized injection, right? Yes, you get that better, temporarily relief, but the pain comes back. Always come back, because your body is not being fixed. Your body is still not working. Of course it's going to come back. Okay, so we gotta fix your nervous system. We gotta make sure your joints are fine, are doing well. Your brains are doing well. All the nerve neurons are flowing nicely. We've gotta make sure of that. Okay. Now, food allergy, that's a major issue. Whenever I talk about allergy, people always think skin allergy, or allergy with coughing, or allergy with sneezing, pollen, cat and dogs. But food allergy can cause a lot of major pain. Major pain from the food. If you eat the wrong kind of food, your finger will swell up like a balloon. If you stop eating that kind of food, the finger gets better. Okay? No, patient comes to me, I explain these. They don't believe it. And I tell them, go prove it. Stop eating this diet, see for a week. And I'm right every time. I'm right every time. Okay, and after that they believe it, they come to me for more advice. Okay. Now we gotta find out what food is bad for you, what food causes the pain to the finger and the toe. We gotta find that out. It's very important we do that. Okay. Now the reason why I put these out, because these food are, most of these diet is either genetically modified or it's going to be modified. Okay. Which tomatoes modified? Why they're big, huge, right? Cotton modified, alfalfa modified, rice not yet going to be. Wheat's modified, corn's modified, sugar beets modified, squash is modified, salmon going to be, not yet. Okay, soy for sure, canola yes, yeast yes, peas yes, Hawaiian papaya is also modified. Okay, so think about all the modified food that we're eating. All these are genetically modified food. If we eat these food constantly, don't you think our body is going to get modified as well? Our body will no longer be now our own body. Our own immune system is going to start attacking our body because we're eating all these foreign substances. Doesn't it make sense? Okay, so we got to eat the right food. Get the right, go to farmer's market, you know, get the organic grown food and start eating those food. Okay. Now, refer pain, it's another issue, because when patients have joint pain, let's say finger pain. A lot of patients, when they come to me, they have this, you know, thumb, they couldn't move their thumb, right? And they call it trigger thumb, because the thumb's stuck here and they can't move it. If they want to move it, they have to like force it down and click, and then when they extend the thumb, it's stuck again. Okay, what do you call it? Trigger finger. And when you have these kind of finger, we gotta also not only are we looking to the joint, we also look at the refer pain, because if you look at the spot here, the area that refers to the thumb is C6. Okay, if you have issue with these two fingers, it refers to C7. It's C7 here, our neck here. If you have issue with the last two fingers, it refers to T1 of our spine. Okay, so there is a relationship of the spine in connection to the finger pain as well too. Okay, not only just pain, it could be numbness, tingling, spasm, whatever it is. We have to look at this as part of our treatment as well. Chinese medicine theory, this is one of the major parts that we look into it as well too, whether your body energy is not working, whether your meridian system is not working, whether your body has too much wind, too much qi, too much dampness, your qi level is not good enough, your blood is not doing well, fluid in your system is not going, your yin yang is not balanced, meridian system is not balanced. All these issues has to be looked at. It helped us to heal the body faster, better, and more efficient. Okay, so we have to look at it into this Chinese theory as well. Okay, brain function, we talk about that. Now, if the brain is not working, like we say, it affects our emotion, our sensation, our behavior, our balance. Not only does it affect these mood problem, it also affects all the nerve system down to different organs, right? The brain also controls all the muscle, the nerves, right? All the tendons and ligament, because it sends impulses to our hands, our feet, so we can move, so we can walk, so we can lift, so we can work with our hands. It's all because of the brain. Brain is not working, the hand will not work. Simple as that. So to treat the finger pain, we also look at the brain. Okay, the brain is divided into more specific function. We call it delta, alpha, theta, beta waves. Now these waves, we have to look into it to make sure they're working well. If they're not, we gotta fix them in order to fix the finger as well too. Okay, and there's neurotransmitter. A neurotransmitter, if you look at the neurons, these are the neurons within the brain. If the neurons are not connecting with each other, if the signal within each neuron is not transmitting enough, is not transmitting sufficient messages, okay, these neurons, we call it dopamine, serotonin, dopamine, acetylcholine. There's more, this is just an example of it. Okay, if these stuff is not being transmitted from one neuron to another, there is no connection. When there is no connection, our finger will not work. Our finger will not heal. Our feet, our ankle, our toe will not heal. Okay, so we gotta look into this as well too. Now methylation, that's a major issue also. DNA, RNA. There will be other doctor or medical doctors saying that you have arthritis because your parents had arthritis. Your mother, your grandmother, or your grandfather has arthritis, therefore you have it. There's nothing they could do. Okay, there's a way to find out if your genes has issue with that. If it does, there are ways to recover that. There are ways to recover that. There are ways to basically help you improve these conditions. Okay, this is called methylation. Okay, and we'll discuss what we do that we can find out the gene issue for you as well too. All right, we talk about the connection. Okay, the body has to be connected in order for the organs, the joint, everything to work. Okay, so we just talk about layers. So whenever a patient comes in with finger joint, with a toe pain, wrist pain, thumb pain, never ever just one reason. It's always multiple layer of issue, just like the onion. Multiple layers. We gotta take away the layer one by one. Layer of inflammation, layer of toxicity, layer of EMF, layer of the food issue, layer of the sugar issue, layer of the the nerve issue, layer of the organ issue, layer of the circulation and fatigue issue, layers upon layers upon layers upon layers of issue that's causing the pain. Once we take out the layers away, the pain is gonna get better. The pain is gonna go away. Are you gonna live a pain-free life? Okay. X-ray, MRI, bone scan is one of the 3 best way to find out what kind of joint pain you have and what happened to the joint. Okay, if it's just X-ray, it will not be enough. If it's only the MRI, it will not be enough. Has to be all 3. All 3 has to be done. Bone scan is optional, but these 2 has to be done. Okay. Now, if you have gout, how do you know? So we send you for blood tests and test for purine and serum urate level. If it's not normal, then we know you have gout. Okay, or we can, X-rays, you can see, or MRI can see as well too. Okay, we're also going to send you for a blood test for inflammatory panel. RA factor, NA, latex, ESR, uric acid, anti-DNA, C-reactive protein, sedimentation rate as well. These are inflammatory process that we gotta get these done to know whether you have inflammation or not. Okay, not just you go to a medical doctor, he look at your finger and he say you have inflammation. Yes, what kind of inflammation? Okay, what kind of inflammation determine what different treatment that you need. Okay, sugar. Okay, we gotta make sure we get this tested. Blood sugar, HbA1c. If you have this high, for sure you have diabetes. Okay. Insulin antibody, glucose tolerance test. Now, we have a lot of diabetic patients that come in with severe joint pain. And it's because of the sugar level, which is way too high. Even though they're doing insulin shot, even though they're taking sugar medication, still, because these medications have side effect, causes joint pain. We do electrolyte panel to make sure that your body has sufficient nutrients. Okay, whether you have sodium, potassium, calcium, magnesium, vitamin D, phosphorus, lactic acid, and blood pH to make sure your body has sufficient nutrient. And we test your autoimmune panel. We talk about that. Immune system, if it's not working, it's going to attack your own joint. We're going to test for IgG, IgM, IgE, IgA, interleukins, 1 to 12, T helper cell, CD3, CD4, CD8. We also test natural killer cell. We also do C3, C4 complement testing. Okay. Now, this is the methylation test by the professionalcoop.com. You go there, get this done, and it's going to test all these gene issues. If you have issue with the genes, there are ways that we can help you to solve this issue as well too. Okay. This is one of the best way to find out what's going on with your blood. So what we do, we take 1 drop of blood, put it under a microscope, and we'll look at the blood life. Now, the blood is the normal, beautiful blood is going to be show like this. Red blood cell is going to be individual. If your blood is clogged up like this, then we know there is issue that your blood is not moving. Okay, your circulation is very bad. Okay, or you're eating something you're not supposed to be eating. If you have a lot of crystals, we know you have gout. probably. Okay, if you have a lot of infection which is affecting the red blood cell, either bacterial, viral, parasite, it's all going to show on the blood as well too. Okay, this is one of the best way that we do here. We also do pulsing system. So what we do is we pulses your pulses right in the wrist here, and we determine whether you have fire, wood, water. We determine if you have issue with the meridian system. We determine whether your body type is hot, it's cold, it's warm, it's windy, all that. Okay, we do that as well too.